Welcome to an Eritrean perspective, mental, physical, and community health. It doesn't matter where you live in the world, it's no secret that access to health care, to professionals who can provide that care, and health education overall is not accessible to each and every single one of us.
In 2015 alone, more than 400,000 people died of malaria.
It suffers from many problems, such as poor infrastructure, insufficient power supplies, and political instability.
We're living in an increasingly individualistic and materialistic and competitive and fragmented society, and that is not good for all of us, for any of us. It's not healthy for any of us.
This is an issue that touches just about every family in this country. It could be your kid or the kid sitting next to your kid.
Across Africa, 1 in 4 children is still not protected by mosquito nets or indoor residual spraying.
It is especially important to speak on these things since we are in a pandemic, but in general as well, having these conversations, these discussions, talking about these events can make a world difference in how we approach health and how accessible this health becomes. In this video, we're specifically looking at Eritrean diaspora, Eritrean communities, the individual, and people who provide care to the Eritrean community.
I think, substance misuse, poverty, those are the things that have a real impact on people's mental health.
80% are directly affected by mental illness, whether it's through family members, friends, or colleagues. Mental health does not discriminate. It affects all people of all ages, educational or income levels. Mental illness or issues with mental health do not come out of thin air. It's a mix of genetic, biological factors, the environment the person is in, and even just the personality of the person mixing in with these other factors can have a huge impact on their well-being. A society's perspective of mental health, what mental illness is, whether it exists or not, can be huge in whether someone goes and finds help or tries to find help, tries to have treatment for that issue that they may have, and the stigma overall is a huge barrier to any form of access, any form of communication when it comes to health issues, and presents itself as a serious problem.
Is the modern world making us ill, or are we medicalizing normality?
Worldwide, 1 in 4 people are affected. If you've ever read the news, maybe even looked at social media, mental health is being discussed.
Child and adolescent mental health disorders are the most common illnesses.
However, when we look at it from a generational perspective, it looks like millennials and even Generation Z or Z are actually taking mental health and its treatment serious, more serious than previous generations, and are also suffering more from it as well. Now, there is speculation as to why, but the statistics don't lie. It's important to keep in mind that mental health, its symptoms, how it expresses itself is different from individual to individual. The World Health Organization estimates that 1 million people worldwide die from suicide each year. 1 million people. That is a lot of people. One person is already too much. 1 million, something needs to be done.
60% with depression and 80% with anxiety do not get any treatment.
Now that we've got the general idea out of the way, we can look at mental health within the Eritrean community specifically. It is no secret that mental health access and care is quite limited for the Eritrean population, as its understanding is still yet to grow. A traditional sense or understanding of mental health is still very prevalent, so getting those ideas changed or making people more aware of what mental health actually is is quite difficult to achieve. Services are not only limited to the Eritrean population back home, but for the diaspora as well. People who've recently left Eritrea are still struggling to find access to appropriate mental health care, as things like language barriers, as cultural understandings or culture shock is still very rampant, and many people as a result take their own lives or end up using substances to escape the reality of their lives, their experiences, and the harsh conditions that they've seen. Now, in my research, I was unable to find mental health services or the types of mental health disorders that exist within the Eritrean community, as those things frankly don't exist. So getting data is more dependent on news sources or information that has been conducted outside of Eritrea itself. What intensifies this issue is that there's still quite a lot of stigma surrounding mental health services or people's mental illnesses in the Eritrean community at large. Now, if you are considered as someone that's possessed perhaps, or just lost their marbles and no one's taking you seriously, then of course you're not going to go and look for mental health services. You're not going to know they exist, and neither is anyone around you as well. This isn't to say this is anyone's fault in particular, it's just that now with our rise in knowledge on this matter, we should try harder to make this an accessible and affordable, a reality that can be achieved by anyone, and right now that isn't the case. Pretending that something doesn't exist doesn't make it go away. Therefore, we need to acknowledge its existence in order to treat it. Yet again, the majority of research is concerned about political instability or political power as opposed to the specifics that Eritrean communities need. Are there many issues that can be discussed right now? Absolutely. Are we going to do that right now? Absolutely not. We are focusing on mental health and later on physical health as well, but we're doing that through the lens of health systems, healthcare, mental health professionals, research, and any establishment or organization that can provide it as we speak. We need to learn how to crawl before we can walk, and before we can run, we need to know how to walk, and that is the mindset we're applying today. I'm going to read something that was sent to me by someone who suggested this mental health topic on the Eritrean community to me, so I would first like to thank him for that, and he wants to remain anonymous, so we're going to use an alias. The brain, like other parts of the body, can be exhausted with a lot of unnecessary data that later affects our behavior. Everything about our experiences, both internal and external, generates new associations with our mind. This association could be good or ungrateful to our daily activity, even our existence. Almost everyone has had a time when they felt down or had thoughts that could make them feel badly about their life. When we're depressed, our thoughts can be extremely negative and distort our view of reality. In such cases, it is easier to sit in a painful certainty than to deal with the daily stresses. Industrialization and urbanization, along with their contribution to the complexity and change of a society, gave rise to antisocial acts and behaviors. Abnormality and personality disorder is one of the consequences of such changes and developments. It is increasing at an alarming rate with the complexity of society. Different psychological problems in the young generation has come to be more visible and is being noticed more easily. Henceforth, comprehending the fact that this problem is increasing and different psychological problems among the youth of Eritrea are being neglected by the society, there is a different answer why the society does not recognize this problem. It is a lack of awareness and the stigma that comes with it. That was by a psychology student who has a master in clinical psychology, an Eritrean who was passionate enough to send me this piece. So go follow him on Instagram if you would like to see more or would like to follow him. Now we're going to look at physical health when it comes to the Eritrean community at large. To do that, we are specifically going to look at diabetes. Now, it isn't a foreign word to many of us. We've heard of it, we are speculating about it, we associate it with activities like eating a lot and perhaps gaining a lot of weight, considering the number of people who not only have diabetes, but how strongly it is increasing for many populations around the globe. Diabetes is a disease and it causes essentially high blood sugar. The average person has sugar within their blood. However, it does not exceed a certain limit as your pancreas releases insulin to ensure that your sugars go down to an appropriate level, but doesn't go low enough to harm you either. In a diabetic, there is a problem as the pancreas either A, does not produce enough insulin, or B, produces none at all. There is much speculation about why diabetes is increasing on a global level, how to cure it perhaps, ways to avoid it. There is scientific literature on it. There are different guidelines depending on where you live as to how to care for a diabetic patient or your own diabetes. Eritrea itself has almost 100,000 people within the country. This is not counting people who live outside of the country who have diabetes, whether type 1 or type 2 in the adult population. Now, most people know of type 2 diabetes, but there is also something called type 1 diabetes that is very strongly present within youth, so children and teens that mostly get diagnosed with it at first, and is not caused by environmental factors, meaning it's not about what you eat, how much you weigh, how you look like. You can be a bodybuilder and still get type 1 diabetes. Type 2 diabetes tends to be more related to diet, but there are also other factors such as having a parent who had type 2 diabetes that could increase the likelihood of you being diagnosed with it as well. Type 1 diabetics are insulin dependent, do not have a choice as to whether they can take insulin, but there are type 2 diabetics who may not need to take insulin. In addition to these two categories, there is also gestational diabetes, which is diagnosed when someone is pregnant. It is temporary most of the time. The final category would be pre-diabetes, which many people fall under but have no awareness over, and essentially it means that person is at risk for developing diabetes. Now, the problem with diabetes isn't that it just causes high blood sugar levels, is that the prolonged levels of high blood sugar levels can cause issues with different organs in the body, your eyesight, nerve damage, heart attacks, strokes, anxiety, and the list goes on. So it is a pretty serious condition to have, and taking care of it is extremely important. Approximately 422 million people around the globe actually have diabetes, especially if they come from low or even middle income countries, and 1.6 million deaths annually are related directly to diabetes. The prevalence of diabetes in Africa was approximately 3 million in the year 1994, so a couple of decades ago. However, last year, the number has increased by over 6 times the number it was in 1994. So now it's surpassed 19 million cases of diabetes within the continent. Eritrea every year on November 14th acknowledges that day as World Diabetes Day and the whole month as World Diabetes Month. In terms of the number of people in Eritrea who have diabetes, it stands at around 3.8% of the adult population and almost 100,000 cases within the nation. The Eritrean National Diabetes Association acknowledges World Diabetes Day, raises awareness for it, calls attention to it through various means, including things like ceremonies and free checks to ensure that their eyesight, for example, is up to par. The risks, symptoms, effects are still somewhat vague for Eritrean nationals. Getting more of that information out there, making it more accessible, should be a priority, especially with the rise in cases. Now we're going to look at a community member's perspective. Yet again, this community member is someone who wants to remain anonymous. This is someone who's in their early mid-40s, who's grown up in Eritrea, is very familiar with the culture, the norms, the expectations, and their understanding of health, and will be talking about their experience when it comes to seeing someone who's a diabetic and how they're treated, what they do to take care of themselves.
حمام دايبيتك دبهان ويكا بتقرينيا حمام شكر كنبلو أين مرن هتيم سامعي هنا يفلتن قل كابش حميبي كابش حسي حادثة ويكا كاب كلتش حادثة بسي يروني يا مالك أنا خاب زرعهم حجي كلتسبات كاب زفلتهم على مالك كلتسبات حمل الشكر يا زبالالو حمل بلعو وتحمل مريري كم بلعو شكراو نجر دلو مقبع وستينيو بتي شكر بنسوتيو بتي شكر شهساتيو اتمقبي تتنكي من وستو مقبخ أحملتي مبسحتو سقاخ وستو إليه انجراخ سقم دبال أخللو سقم وستو تقاف بلعو كالب ما شالع بلعنيو مستيساتينيو بخمسة بدي مدهانيت بزح كزي سبات كنبرو رغي قل እቶም ታይዋን ዝበሃል ደለዎም ሰባት ግን ሓደ ሰባት ኮንሲልን ወስቱ ሰባት ኣለና ኢለ ማለት እዩ እዞም ሰባት ግን ብጣዕሚ ዋላሶም ሽኮር ኣለዎም ዋላሶም ታይዋን ኣለዎም ደቆም ፈፂሞም ኣይሓምን እዮም ደቆም ዲያቤቲክ ኣይኮኑን እዮም እሶም ተኮይኖም ደቆም ኣይኮኑን እዮም ኣብ ዓድና ከምኡ ኣይኮነን ምክንያቱ እቲ መግቢ ኣብ ዓድና ዝብላዕ መግብታት ኩሉ ኦርጋኒክ ማለት ሲ ከዓቢ ከሎ ብዘይ አንቲባዮቲክ ዝዓቢ እንስሳታት ብዘይ አንቲባዮቲክ ዓብያ ስጋ ብዘይ አንቲባዮቲክ እዩ ኣሕምልቲ ባዕሉ ካብ መሬት በቂሉ ብግዚኡ ወፂኡ ተዓቢ እዩ እኽልታት ድብላዕ ኩሉ ኦርጋኒክ እዩ ጥሬታት ፅሩይ እዩ ኣነ ሕጂ ሓንቲ she's like relative እሳ ዘመደያ ማለት እዩ نشتي كله مالتي أب شحنت شعات ميتن سبعان شمنتن أب سبعان شمنتن ديابيتك مخانة تفليتا مالتي حمام شكر كم زلوا تفليتا تايبوان يروا إتي أنتي أب تجزيتي كفلت كلا عدمية قول 4 عمت 4 كاب 4 سكاب 4 سلستن 4 كباب تقول نيرا مالتي سلازي بهوموسي كندي عمت صنيحة 4 عمت مستفلتت كي تفلتت 4 مستفلتت 4 9 عمت صنيحة أدمية مالتي 9 عمت تصنح كلا حتى ما يكونتين بزح كستاي بلان قل أنسيلين توسط نقول حنتي أنسيلين توسط مقبات بلع مش هتقدك اسكالا وسيطة تحضر مقبات بلع بقى بخمسة نبر نيرة أما بال9 عامتها كيدا مالك.
Now there are a variety of organizations that have been popping up everywhere around the globe to help Eritreans understand their own health better, educate themselves better, educate others, and in general make things more accessible. So shout out here to My Health. My Health, as it states here, is health education for Eritreans by Eritreans. So they make sure that resources are available in a variety of languages. The main languages that are spoken by Eritreans, so Tigrinya, English, and even Arabic, and ensures that people are able to access these resources themselves. And they even have information in regards to COVID-19 available on their website myhealth.com to improving people's health, bettering their understanding of their own health, and just ensuring that people have access to this type of information. please go and follow them on Instagram as well. It's My Health, and there they post a range of different events, as they call them, on their site. So they will be hosting different people who, for example, show different exercise routines you could be doing right now during this pandemic, or information sessions about this pandemic in Tigrinya, in English, and if you follow them, you'll keep up to date with that information as well. If we look at their site and even click on some of their links, so we were talking about mental health and diabetes earlier on, you can see how it's in a PDF format, so you could probably download it and read it, or read it while you're online. You can see it in a different language if it's easier for you to understand that way, and this really ensures that people have access to something in their own free time. If you look at the About section of their website, it simply says that they're trying to create a place whereby Eritrean diaspora specifically, or anyone else as well really if they wish, can come there and find things or content that are health related, that is accessible, that makes sense to them, whether it's in English, yet again, Tigrinya, or Arabic, and they can improve their own health, understand their own health, and make the education in regards to health accessible to all. And this is specifically in regards to things like nutrition, exercise, mental health, and various other things they cover from time to time as well. Here I'm showing you guys a couple of the events they were recently holding as well, and this was all on Instagram alone, so why not go and check them out. They also have a link for other organizations that you could check out, and one of them includes the Eritrean Canadian Community Center, so it is specific to Canada, where they're yet again providing links and access to different information, or valid information should I say, in regards to the pandemic and what one can do, what type of access one has, not only to health but also financial means. So go yet again and check them out. Finally, there's also links to different videos from professionals and educational content that you can watch at your own time, learn something from. In my search for organizations or groups that help Eritreans, I came across the America Team for Displaced Eritreans. They are based in Pennsylvania, and they look to help refugees, asylum seekers. So the America Team for Displaced Eritreans is also a public charity. It's great to see Eritrean organizations popping up, coming together, whether volunteers or whether work professionals. However, we still need a lot of work to be done. But now we're going to look at a care worker's perspective of health, an Eritrean care worker, their understanding, their experience, and the type of care they provide, as a professional can give a lot of insight in addition to community members and organization as to what needs to be done.
Hey y'all, my name is Selena. I'm a YouTuber. My YouTube is Itsalu. I do a lot of Africa related videos, and I also work in a nursing home as a recreational therapist. So I'm doing this video as kind of like my insights on healthcare that I provide in a sense, and what I go through on a day-to-day basis at work.
What motivated you to go into your current profession?
I didn't even know about the profession until my sister actually brought it up to me and said that you can have fun with like residents at work and get paid for it pretty much. So what I do at my nursing home is I'm the bingo girl basically. I'm the one who plays bingo with them. I'm the one who does a lot of outings with them. We go to outings a lot. Say we go to like a restaurant with them. Just kind of fulfill that recreational need in the resident's life, and also do like, you know, we go into their rooms, have a chat with them just in case like they're feeling depressed or lonely one day. That's what I pretty much do. So when my sister basically told me you can do stuff like that as a job, I'm like, that's pretty cool. Like, you know, it's something that not many people would actually think of going into. So I went to school. I did the recreation leisure program for 2 years, and I found a job, and I've been doing that for about 3 years now, 3 to 4 years. So it's been interesting.
Now, what would you say are some of the challenges you face at work?
I work in the dementia unit. Dementia is, we don't like to call it a disease, but it is kind of a disease that kind of characterized by their memory and in terms of speaking or eating or even their physical body, like they start to deteriorate, they can't remember how to walk. So it's kind of like a disease in the brain. And it's kind of hard because when we go into work every single day, and because I work in the dementia unit where a lot of them could be aggressive, a lot of them want to get out of the home, say they don't live there and they want to go home to where they were used to live, you know, with their wives or their husbands or with their kids. Every day is different, so it's a challenge every day because we come up with calendars for our units, and that calendar is just a guideline. Because a lot of the time you may say you have bingo planned for that day, but there's so many people that need your attention that you can't really do bingo that day. You gotta really look out for the other residents. Maybe there's a fight going on with other residents. Maybe one resident's really depressed and they're crying and they need some, you know, emotional support. So there's just so much in a day that every day for me is different. Every time I go into work, every day is different. And that's kind of what I like too, is that you're like, you go in, you're like, okay, what's good today, you know?
In your personal opinion, what would you say are some of the barriers Eritreans face when they're trying to access health or health care?
Because I didn't go into health like that too much, like into nursing or whatever, some of the barriers I feel like would be language. Like say for example, our family doctor is from Greece. Yeah, he's from Greece, I think. Yeah, he's from Greece. So my family and stuff, he understands, like he's an immigrant, whatever too, right? But my dad found an Eritrean doctor that's, you know, that's in the same clinic as us. He went over there to him because he found it was easier to talk to him and easier for him to express and explain what is going on with him. Like say with his old doctor, which is the man that's from Greece, it was kind of hard for him to kind of understand and kind of express what was going on, what he really felt he needed to say, because Tigrinya is his first language, so it was easier for him to speak to an Eritrean doctor and for him to be like, do you understand what I'm saying? They do have that feeling sometimes, so that could definitely be a barrier. I find is language is huge.
What would you say are obstacles that stand in the way of Eritreans receiving help or treatment for health concerns that they may have, in addition to the access to healthcare that they're struggling to get?
Access, definitely. Like my example with my dad, that's like if he didn't have that option, like we in the same city, our city is like not small, but it's like you don't get too many immigrants from Africa, let's just say. So the fact that we have an Eritrean doctor and an Ethiopian doctor, but the Eritrean doctor came first before the Ethiopian. So if we didn't even have the option to have just not even an Eritrean, but even an Ethiopian doctor, it would be so hard to have, you know, say new immigrants coming from Eritrea or Ethiopia to where the city that we're living in, and they can't communicate with the doctor that's, you know, provided for them because they don't understand what they're saying, you know. So that's a huge obstacle. Like I was saying before, language is a big obstacle, especially if you're coming from a different country, and you know, just not even Eritreans, Ethiopians, or Africans in general. It's a huge obstacle, you know, finding out what's a good doctor for you and for your needs, and also, like it says, receiving treatment. If the doctor doesn't know what you need, it's hard for them to give you the treatment that you need.
Do you think that the health sector, as it is, delivers culturally sensitive or appropriate care to the Eritrean community? Why or why not?
In that health sector, I'm not 100% sure because I don't work in that kind of health sector, but if I'm going to be talking about the older care, probably not. It's still growing in terms of, if say, if I were to receive an Eritrean or Ethiopian or African resident coming in, especially like if it was an Eritrean resident, well, I would be happy, but because I could easily relate to that resident, right? But there's not many of me, you know, recreational therapists working in nursing homes to do that, you know what I mean? So it's hard because, you know, the population of residents in a nursing home are mostly Caucasian. Maybe a few, you know, Middle Eastern or Chinese or whatever, but majority of them are Caucasian. A lot of them are going to have that knowledge of them. They're not going to have a lot of knowledge of the Eritreans, so I find it would be very hard for them. If there isn't more of me out there, Eritreans that can do recreational stuff with them, they may not receive the same treatment as they were to have with a Caucasian person in the retirement home or in the nursing home. So yeah, I don't think they would receive as much as, say, somebody else would.
Why do you think it is that Eritreans are so reluctant to discuss or even acknowledge mental health concerns? Do you think that culture perhaps plays a part?
100% it does. Like, it's really sad because, like, for me and my family, like, my mom's in the healthcare, my sister's in healthcare, I'm in healthcare, my brother's going into healthcare, so pretty much our whole family is in healthcare, and we understand that mental health is huge. Like, it's a thing. At the same time, if we weren't in healthcare, we wouldn't probably know as much as we do. We were exposed to it as well. We're exposed to so much, like, mental health and dementia patients is real. Like, a lot of them have depression because, say, some of them went through like the World War I, World War II or whatever. That can cause a lot of depression, PTSD, so post-traumatic stress disorder. So it's real. It's definitely real. We're reluctant to discussing it, maybe because we're afraid. We're afraid of what could come out of some people. And some Eritreans think, like, and I've heard it, they're like, oh, that person's just crazy. They're just crazy. Like, if they're crying out of nowhere, oh, they're just crazy. You know, they're just crazy. And it's true, because a lot of them don't know. They don't know why that person's crying out of nowhere. They don't know why that person is stuck in the corner by themselves and not speaking to nobody. They don't know why, because it's not discussed as much as it should. And depression is huge. Like, that's one mental health thing that I think goes around with a lot of Eritreans, because coming, say if they're leaving Eritrea to go to like Italy or England or wherever, like, they go through a lot, they see a lot, that will cause a lot of depression, that will cause a lot of PTSD. Like, the amount of stuff those people see and go through and then make it to start working and stuff like that, they're going through a lot up here. They may look happy here, but they're going through a lot mentally, and that needs to be discussed. They need help, and they probably don't want to reach out because they don't want people thinking that they're crazy.
What do you think we can do as individuals to improve health habits, or even as a community? And are there any solutions?
I think discussion would be that would be something that we could improve on as a community and as individuals. Like, you can talk to each other, you kind of open up that discussion, open up like seminars or little meetings, or like just open shops, and can kind of have that discussion. But let's be ears to people who need to speak, right? A lot of people are going through a lot of stuff, and we don't really know what they're going through until they tell us, because, like I said, they're masking a lot of their anxiety, because they need to be strong for the world. They need to be strong maybe for their families, maybe their mothers who are going through so much, or fathers, or whoever, right? So they're probably masking a lot of that anxiety and a lot of that fear just to go by day to day, right? And I feel like what we can improve on is just talk to each other, communicate. Open communication is key, I think. Like, if we're in anything, like in relationships and families, and, you know, if you're not talking to each other, you're not improving anything. You know, you're not improving problems, right? I think that's a big one.
You work with an older population within North American society. How do you think that compares to the treatment and care of elders in Eritrea, or the Eritrean population of elders here?
Oh, that's a big one. To be honest, like, I think when I went back home, I did not see any... First of all, there's no nursing homes back home. Like, let's be real. There's no nursing homes back home. I didn't see any person back home with, like, dementia or Alzheimer's or anything like that. And I think most of it, like, I don't know if it's really scientifically proven. They say it is, but it could be from the foods that we're eating. It could be a big one that could cause dementia and Alzheimer's. But care and the treatment is different, because back home, you're not, like, if I were to tell them, they kind of find it was weird that I was working with older people, but they're like, you know, that's a job or whatever. But like, if I were to tell them like, yeah, so people take their parents to a home and other people take care of their parents, they're like, what? Why don't they just take care of their parents themselves? But I guess they don't understand that Alzheimer's, dementia, all that kind of stuff can affect the brain, and it can really, like, some residents can be very abusive, like physically abusive. People can't cope with that. They can't understand how to take care of that, you know. So that's one reason why some of them put them in a home, because for their safety, for themselves, and for the residents. So but back home, that doesn't really happen a lot. You don't really see too much, you don't really hear too much about that. Maybe it does happen and they just don't want to talk about it. This comes to the whole thing when it comes to healthcare and health itself. Maybe nobody's speaking about it. Who knows? But from what I know and what I'm hearing is that the care here in North America to Eritreans is very different. You know, back home, they're taking care of their parents, you know, they're feeding them, they're making them breakfast, lunch, dinner. Like, they're really taking care of them. And like, from my experiences, both of my uncles and aunts took care of my grandparents until they passed away, because they lived at home with them. So, you know, it's different. It's very different. You know, you don't really see that much here. Sometimes you do hear people like have their parents at home with them, like, you know, but for the most part, it's very different. Like, you don't hear many people taking their parents to a nursing home back home and, you know, getting somebody else to take care of them. For them, that would be like, what the heck? That's my parent. I can take care of my parent myself. Thank you very much.
Special thanks to My Health, Selena with the Akbaret, Ade, and everyone else and anything else that's contributed to the creation of this video. I believe conversation is extremely important, and we're all at home right now. Why not have those conversations? Why not raise awareness? Why not make a difference, honestly, while we're living on this planet, for our fellow man or womankind, for our communities, and the Eritrean community that I hold near and dear to my heart. I hope that this somehow creates more conversations. Conversations have been started, and that is amazing, that is great, but we can do so much more. So why don't we do so much more? Talk about it, share this video, acknowledge the people in this video, check out their work, their organizations, and anything else that they're doing to really put their heart, soul, time, and everything else that they have in improving our community. So if you're an Eritrean, share this. If you're not an Eritrean, I hope this was informative in some sort of way. Share it. Sharing is caring. Remember, stay home, wash your hands, wear a mask, and take care. Bye bye.